when you look at Congress this year, they came up with the Treat and Reduce Obesity Act, which was supposed to kind of open up the spectrum of looking at obesity care and coverage across the population. It has not passed. It does have bipartisan support, which is not normal in the current Congress. But I think that one of the things that we can talk about when we're looking at issues like obesity is it is bipartisan. It doesn't affect Democrats or Republicans differently. You can't say that, because you have X socioeconomic status that you are going to have less of an issue of dealing with it. And so I think that one thing that's maybe good, if you want to use good as the word or adjective to describe it, about obesity is that it affects everyone. And everyone has struggled in some way. But often people still recognize it as a responsibility, a personal responsibility, something that someone's not doing well enough for themselves. And until we recognize that it's so much more complex than that, there's the brain controls how the body sees weight. And the treatment modalities that are out there that have been shown to be more effective are those that target how the brain sees weight. If we can get kind of the general population and or policymakers to recognize that, then we can then develop actual obesity policy in the United States to target this disease process. When we look at obesity compared to, let's say, diabetes or other things, other chronic disease processes in the United States, obesity is really the only one that has no policies on the books. To date, there are no policies, despite the fact that our obesity rates and percentages are much higher than that of any other developed country. So it's really kind of, sad. We claim that we're the best and the brightest, yet we have yet to come up with a comprehensive obesity policy in our country. We have different targets and different goals that are put forth by U.S. Department of Health and Human Services guidelines with physical activity, like that came out in 2008, or there are different kind of roundabout ways of trying to, address obesity, but they're somewhat archaic and don't really capture the whole disease process. And so I think, the idea of getting policymakers to understand obesity will help shift, first of all, developing an actual policy and shift how we think about, obesity targets and treatment throughout the entire population.